is looking at. Let me first say, but this matrix ideally is for you to take back and kind of look at, and I think one step further is see if you can see yourself fitting in anywhere there. The Lewin group that was hired to do a lot of the work for the 208 Commission, they found that in 2005 there were 1.1 million Coloradoans that were uninsured at some time. Okay, so that means all of us in a lot of ways have the opportunity to become uninsured if you'd like. I think the thing to keep in mind is we're all in this together, and that we really need to look at the characteristics of the uninsured and just the demographics, what's kind of happening down the line. One of the things we always talk about is the uninsured children, and again, those are politically easy to talk about, and we do want them to be insured. But increasingly what we see happening, if you look at the statistics, we have a huge uninsured population between 19 and 34 years of age, right? The next spike, if you will, is between 50 and 64, the pre-retirement. Now that's a significant age group because most of us are going to hit that eventually, but it's also a rapidly growing population. By 2030, they predict that 1 in 5 Americans will be 65 or older. Now the big thing is when you're looking at a younger population and the health care needs that they may need is different than the health care needs that an older population may need. And we're talking about, so when we're looking at these proposals, I think it's important to keep in mind the different kinds of needs that different kinds of populations may need, and not to create a minimum core benefit package, if you will, that doesn't allow for some of these other populations to participate. The other thing that I would like to point out is, as was already said, about 57% of the population here in Colorado gets their health care insurance through their employer, most of that through the small employer market. About 25% get through some federal or public programs, and about 4% get from other programs, and about another 4% get it through the individual market. Now, the individual market is, I think Ella was the one who was talking about it, but it's notorious for being volatile. It's notorious for refusing people to participate and pushing, especially the older populations, if you have pre-existing conditions. And what you'll notice on a lot of these proposals is that that's the market that they want to move to expand health care insurance through. If we do choose to go to that, then we really need to be cognizant of restructuring that individual market and having robust oversight. And that could include rate reviews, community ratings, and a lot of variety of different things. I see so many familiar faces. This is wonderful. Okay. I also want to say that I think everybody has responsibility. So when you look at this, who do we have? There's some here that talk about individual mandates. There's some here with employer mandates, but there's nothing really about providers, about insurers, the role of government, all of those kinds of things. I think those are important to look at too when we're looking at some sort of health care. Finally, what I'd like to also say is that we need to be cognizant of our particular unique fiscal situation here in the state of Colorado. The Bell Policy Center just recently finished an analysis, we call it Looking Forward, Colorado's Fiscal Prospects After Referendum C. How many of you are familiar with Referendum C, all of that? Okay, great. In 2005, the voters basically voted to keep our state revenue, and of that revenue,